Hi everyone, my name is Jacqueline Castro and my presentation will be based on leadership and training for physicians in California. So the learning objective for my presentation will be based on the huge capacity gap of primary care, the lack of basic leadership skills among new residents. Also, my outline will follow the importance of quality leadership education among residents and the type of patient care non-physicians can perform. So, leadership training in the medical field is not taken seriously because it is not viewed as a science that will include the separation of hospital and medical school. Medical students are not taught leadership skills, that's why they feel like they don't need them in the hospital environment. But well rounded physicians can deliver better health care. So, the biggest problem is the lack of leadership training during their graduate medical education. As a result, leadership training is usually taking place after the residency program. Also, an enormous gap among physicians and primary care patients is another issue. So, this results in physicians complaining about time consuming tasks that other non physicians in the hospital are capable of performing, such as blood tests, pregnancy tests, very acute healthcare issues. Also, not enough physicians equals improper healthcare delivery because physicians tend to be rushed and they consume a lot of their time. Survey analysis shows that on average, physicians spend 46% of their time on acute care, 37% of their time on chronic care, and 17% of their time on preventive care. So, therefore, if physicians were to relocate their workload to non physicians in hospitals, they can save on average 24% of their time. This would cause less stress, less paperwork, and less what they call physician burnout, is when they show that they are very overtired because of all the workload. A solution to these problems would be the University of San Francisco has come up with a program, a resident training program that implements leadership skills during the period of their residency training. The program is called PLUS, which stands for Pediatric Leaders Advancing Health Equality. The PLUS program incorporates a development of leadership skills into the basic standards of clinical training. That way, they receive their training around leadership before they leave the residency program and they leave with some experience on how to handle certain situations. Another solution that can help the lack of physicians to take care for patients and their needs would be to promote non-physicians to take on the tasks that they face daily. For example, they can promote licensed nurses to perform blood pressure exams, pregnancy tests, and more. They can also use technology such as the Standardized Patient Instructor, also known as SPI. It analyzes patients for the first 7 minutes and then delivers back to them a diagnosis for around 30 minutes. In total, the whole program is 20 minutes long. Another solution would be patient self-care at home pregnancy tests, HIV tests, or blood pressure. Kits can also help patients and save time. So, in conclusion, by distributing the workload evenly among other workers in the hospital and properly training residents on leadership skills will result in an outstanding delivery of healthcare to patients and also help the hospital run more smoothly. Thank you for listening to my presentation.